name is Vivienne. I'm the renal lead for Optimise interviews, and this is just a quick video to tell you about some helpful renal resources for your interview, and for any of your revision. So I suppose if I had to pick three things that I wouldn't necessarily go into the interview without having revised, one is know your blood gases. Usually at some point in the clinical scenario, you will be handed a blood gas. And usually it's going to show something like a metabolic acidosis, or it's going to show hyperkalaemia. And they may want you to comment on the bicarb. Also keep an eye out for the HB. So in terms of blood gases resources, there's lots of good ones on YouTube. The Geeky Medics ones are always very good. But just a refresher on your blood gas to make sure that you're confident with that. The second thing that I would not go into the interview without knowing is the management of hyperkalaemia. You need to know this backwards, forwards, and you just need to have a pit pat with no hesitation. So there are two good resources for this. The first is a new guideline which has come out this year is UK Kidney Association. It's a pretty big guideline, like 170 pages, but there is a hyperkalaemia flow chart, and it's very good, very self-explanatory, and very useful, and it's got all the detail you need. There's also an app or a website called the London AKI Network, and they not only have a similar thing of causes of AKI, management of hyperkalaemia, but they also have what's quite important is parameters for transfer. I think that most hospitals will have these in their current guidelines, but you need to know things like you're not going to transfer someone with a potassium of over 6 or a pH of less than 7.2, or an oxygen requirement greater than 4 litres, etc. So that's also on the London AKI network. And then the other thing that I would recommend for general guidelines, so you can easily get questions on, CKD, supportive care in clinic, AKI extensively, diabetes and diabetic nephropathy. And so what I would do for that is I would look at the KDIGO guidelines. UK Kidney Association also has guidelines, but KDIGO is more international. Obviously there's tons and tons of guidelines on their website, so maybe just downloading the app and looking for key guidelines. And I think that would be very useful for the interview. Okay.